be deadly as well. So the reasons are many and are not specific. And as I said, it could be environmental, it could be genetic, diet, or lifestyle in general.
Okay, and that's where you come in, because you have to see what is going on before you can treat it. Let's talk about how diagnostic imaging, which is your field, contributes to the early detection and diagnosis of these common cancers.
Okay. So you've mentioned two key terms, detection and diagnosis. Detection is not necessarily diagnosis. So the first line of detection using medical imaging techniques is to, first of all, identify and visualize an abnormality in tissue.
So you want to see it first?
You want to see it first. So once you see it, that's the visualization stage. The next is to proceed to use other advanced techniques. So for example, we could use X-ray, we could use CT. CT is computed tomography, which gives us a visualization of the abnormality in tissue. Now, beyond that, there are other advanced and sophisticated techniques we can then use to now confirm and diagnose. One of those usually is a biopsy, where we take a sample of that particular abnormality we are seeing for laboratory tests. But that is often invasive. Invasive here means that you have to cut through tissue, you have to quote unquote wound the patient somehow. And so medical imaging has now...
So that would be like taking a biopsy, you take a piece of the person's skin.
Exactly.
Go and examine it.
Okay. And so when you do so, you are able to identify whether it's malignant or benign. In other words, whether it's a kind of cancer disease that can spread, or it's just a lump that can be removed subsequently. So just beyond, doing biopsies, medical imaging has now advanced to a stage where we no longer would even need to do a biopsy. We now have molecular imaging techniques that would, reveal cancer tumors in a manner that you can measure the volume and also even the site and spread of the cancer. So we have what we call nuclear medicine techniques, whereby you use radioactive elements that are injected into the body, and wherever the cancer is located, it's sensitive to these radio materials that then would absorb that into the tissue, so that when we image, we visualize the extent of spread.
You see it in terms of color, right?
Yes, exactly. We use color to be able to see and map out the volume and spread of the cancer. There are also biochemical imaging techniques, like what we call spectroscopy, whereby when you do the scan, you are able to see spectra that represent various biochemical processes, including what would serve as a biomarker to cancer that we can interpret and be able to tell the type of cancer and the extent of the cancer it is.
Are all these methods to detect cancers available? I mean, you're talking about X-ray, you're talking about CT, you're talking about spectrum, all of that, are they available here? Which are the ones that are available for the people?
Okay, well, in northern Ghana particularly, the commonest ones that are available are X-ray and ultrasound. And these are used also for the procedure. But the advanced ones, which can give a clear visualization, so far the MRI is the one that stands out, that can give you a clear picture of the tumor that you can do accurate measurements on. But we don't have that in the whole northern Ghana. So often when patients need to do this, they are referred to Accra or Kumasi to go and do it. So I would say that those available to us currently in northern Ghana are X-ray, ultrasound, and of course CT imaging is also there. And at the moment we have just 3 of them in Tamale. Yes. So beyond that, for biopsy, we do that at the Tamale Teaching Hospital, which is the laboratory side of the whole diagnostic procedure. Yeah.
So what are the key challenges for people accessing this kind of care, these cancer screening and radiotherapy services?
I must say that cancer care, starting from screening, diagnosis to treatment and management, is a very expensive enterprise, to be honest. But of course, when screening does happen, in many cases, it's either free or at subsidized costs for the people. But in many cases, people do not even know the relevance. Why should I go and screen when I'm okay? So when they wait until the condition begins to manifest, at a stage when it now becomes a disease to manage. That's where the whole cost elements become a challenge for people to access healthcare.
When you're talking about costs, what are we looking at? What are the ranges?
For example, averagely, if you're going for a CT scan to detect that, you are expected to pay around about 500 to 600 Ghana cedis per scan. And so that is not cheap for the average northern person here. And beyond that, suppose that there's diagnosis. What then follows is the treatment regimen. And in this case, what kind of treatment are we going for, depending on the size, the extent, and the severity of the condition? It could be surgery just to remove it. It could also be chemotherapy, or in some cases, radiotherapy. So when it goes to these stages, they vary in terms of cost, relative cost. And radiotherapy stands out as the most expensive one, and we don't even have that facility in the whole of northern Ghana. So that would mean that there will be travel costs, there will be accommodation costs, there will be someone to accompany the patient to the site, feeding all that stuff. So all that becomes very expensive at the cost of the patient. And there are no support systems in terms of funding or even insurance schemes to take care of these conditions.
Is cancer treatment on the National Health Insurance?
At the moment, this is something I cannot tell for sure in terms of whether there are specific cancers that are covered or not. But to the best of my knowledge, no. People fund it themselves.
Yeah. So that really tells of the need to do your screening. Exactly. What are the challenges that you have with people not making themselves available for screening, apart from the fact that they say, oh, I don't feel ill, so why should I screen? How do you break through that challenge?
First of all, I think that what we are doing currently is one of those things we need to do to try and reduce the cases of people not coming or making themselves available for screening, which is education. In many instances, people are not even aware of the severity of the condition when it gets to the stage when they now have to be managed. So when people are educated, the information is out there, and they understand what risks they stand to getting cancer and what the severity of the condition is when they get it, I believe we will be getting somewhere. Apart from that, there is so much technology we have currently available here to detect the various types of cancers. Like I said, it can happen or occur anywhere in the body. And so if we do not have the resources available to be able to detect the various cancer types, then I think also that screening would not help much in identifying all the possible cases we can have. But currently, those common ones I have mentioned, we are doing very well at detecting and diagnosing them currently in northern Ghana and Ghana as a whole.
Are there any cultural beliefs that limit people from or hinder people from going to do tests and screening?
I would say yes to that. For example, breast cancer. Northern Ghana is predominantly Islamic, geographical region, and so if women are supposed to be screened, someone would have to access their breasts.
Yes.
And so often that is a discomfort to many women and to many men who are husbands to these women. And so to start with, religion is one which stands in the way of people accepting to be screened.
Are there female doctors and female nurses that can help?
Of course, yes, there are.
That can counter it. Didn't know that it's a female.
Yeah, there are, and that's where we should be moving towards, training more female health practitioners to do this. But in many cases, like in my area, for example, medical imaging, predominantly they are men. So when you go for a mammography examination, chances are that you would have 4 in 5 chances that a man is going to attend to you. So because of that, you might not feel that comfort to go there. It might not be convenient to you. Cervical cancer, for example, if you are screening for that, there has to be a pap smear. Someone has to go into the private area of the woman. And so that one too is a discomfort. And so cultural, religious beliefs wouldn't permit people to go out for these. So these are the major challenges we have here. And it's difficult to try and convince people to let them understand the benefits versus they, exposing themselves to these screening procedures.
So I'm sure one of the policies would be training more women to be part of this particular field.
Exactly.
What other policies or interventions would you recommend to increase the rate of people going to undergo screening for cancer?
UDS, just like other public universities, is currently starting to do one of these things. If, for example, we talk about liver cancer, diagnosis of hepatitis B is a risk factor for getting liver cancer, for example. And we've started doing health screening on the university campus. And if you go to all the other public universities, when students are first admitted, they go through health screening, including Hep B, including chest X-ray, and the rest. So this is the first step, and the majority of these students are, youth. And this is the stage where you could also have many of these cancers happening and degenerating into advanced stages where you can no longer manage them than just to manage the symptoms and the pain. So when we begin to screen at institutions, public institutions, and make it mandatory that people coming in there as part of the communities, we are getting somewhere. When people are taken on for, new appointments, it must also be mandatory that they must be screened. Then there must be a national policy in place to say that, look, some of the cancers too are also, tied to age. As you age, the risk of getting them also increases.
Which ones?
So, for example, people can get brain cancers.
The older you can become, the more likely.
Exactly, because brain tissue begin to shrink and then becomes more inactive at dividing to replace dead tissue. And so in many of such cases, people can develop brain cancers, they can develop bone metastasis of some of these cancers as well. And so if there's a national policy also in place to screen the aged or to screen retirees on an insurance scheme, that could also be a step forward to, reducing the incidence and also increasing uptake of the screening, programs we'll be doing.
Okay. Quite a few policies that you are recommending. Now let's talk a little bit about your center, the Diagnostic Imaging Research Center right here at UDS. What is its role in improving improving the incidence of people now going to do more testing and screening and imaging?
The center just started about 2 years ago. Yes, quite young. And we currently are putting up the structure for the advanced imaging techniques or equipment. And at the moment, we have in place X-ray system, which does partly some of these screening procedures. And our role is, first of all, to do research. And there isn't so much support in terms of funding for research in these areas. And so we would find our own ways of carrying out cancer research using these techniques.
Are there any ongoing research projects you can tell us about?
Of course. At the moment, most of the studies we do are around, first of all, finding the prevalences of some of these conditions, finding out the treatment options people often go for, depending on the type of conditions they have, and in some cases looking at staging of the cancer. When I say staging, what level is it at in terms of spread and severity? So these are the kind of things we currently are doing, and also looking at sensitivity of the various techniques at picking up the various cancer types we have. So largely, these are the kind of studies we do.
Okay. Yeah. All right. Looking to the future, what kind of advancements in imaging and radiotherapy do you foresee happening that can help people living with cancer or in terms of diagnosing the cancer?
At the moment, we are looking at what we call imaging genomics, which looks at combination of imaging techniques and genetical-based techniques. Because cancer starts from the DNA, which is at the gene level. And so if we are imaging and we're able to visualize an abnormality, what that means is that we are at a stage when the disease is beginning to manifest. And so rather than wait until it manifests to see it, we go molecular, combining imaging. When I say molecular, you're able to go, down to the cellular level and determine cellular activities that already are showing signs that this is heading to cancer. Okay. And so when we combine some of these techniques, and of course, machine learning is also on board now.
Also, AI is part of that.
AI is part of all of this. And so current research in the area of cancer combines both imaging and genomics to enhance the sensitivity and also to identify those who may be at risk and those who may not be at risk, even long before it begins to manifest.
Okay. Yeah. Before we go, what's the most important thing that viewers must know about screening and as far as cancer care is concerned? You can address the camera and whatever language you want to speak in to let people know that it's important. Yes.
Well, I speak Dagbani.
Yes, you can say it in English and say it in Dagbani as well.
Okay, so let me start with the English version.
Yes.
To begin with, screening is just one of the key things you need to do to be able to tell whether the lifestyle changes you would have made and whatever preventive measures you are taking, whether they are effective or not. And so, apart from lifestyle changes, people should also take it seriously to screen. You don't have to wait until the month of October when there are many screening programs available. Some of them come at no cost. You need to take personal charge of your own health in going out there to do screening. And there are many facilities around that can help do this. And of course, if you're not sure, speak to the experts. I mean, that's what I would say in short. In Dagbani, what I want to say is that bambi dagbon ni tamalizaha ni kadama tin diri fila shele zanpa kansa ngoma nyela dor shele di baba adam piguma akubang na ala diti mpala sa shele karata biyo nun tom katon yedi yemal akara dibo to bi te pala la man tiya tin kuli tiya shele ko nyela di lore di yen sham ka adi anyavli intapson to ama bukuto tai ka duroma bla yel gebe ka pangse no zoni en pang di timba be jan de sham yela te pang to manga hal din yela abam mimi an chang te paso nyam de bang nyam do atenma ka be yela duroma ma din ye shele ne an nan sham gwa man ka ta ka cin shele to amma de ba go za ha kun yela de maladin yen doli tabibi bang sam shanga an le ka bang me ka dama an jema ma an yela ngonti yela la duroma be a duroma biani ka de bot buzanta. Thank you very
much.
Right.
Thank you. Dr. Abdul Nashiruddin Mumuni is a medical imaging specialist and the director of the Diagnostic Imaging Research Center at UDS, where we are. We want to thank our sponsors for this. Passion Air flew us in here, and UDS Guest House is where we are residing, beautiful place, as well as By Faith Restaurant right here in Tamale, who will be feeding us with great food. We've got a lot for you on our plate as far as breakfast is concerned. Still to come, Easy Paint, sports, and birthdays later on. Headlines, I'll come back in the next half an hour or so, and then Multicity has a big conversation on chieftaincy. There's music, food, drink, culture. We're all celebrating Heritage Month right here in Tamale. It's beautiful, beautiful morning, and we'll be giving you sights and sounds of this beautiful place. You stick around. This is GTV Breakfast. My name is Kafui Day. We're on GTV Ghana on Facebook, so check it out, and we'll be right back after this.